Good afternoon, everybody. Thanks for being here with us. I'm Dan Tsai. I'm the director of the Department of Public Health here in San Francisco. You've got Dr. Hillary Cunnins here to my left. And today we'll be providing an update on the latest overdose death numbers for the city and county of San Francisco, as well as a few updates on some of the things we, this administration, are doing to combat the epidemic that we have. As always, I know it's really important to us to hold these monthly meetings to just be transparent about what the data say and what we're doing. I want to thank the Office of the Chief Medical Examiner for their partnership and really excellent work in being able to provide these numbers each month. So going to the data, these are preliminary data. In the month of April, there were 50 overdose deaths, which is so far the lowest number of this calendar year. Last month, March of 2025, we had 64 deaths. Last year, April of 2024, we had 59 deaths. So April of 2025, we're at 50 overdose deaths with 245 deaths year to date. I want to emphasize, as I say every single time, every single overdose death is preventable and it's unacceptable. And the focus that we have here in the city, the mayor has, that we have at public health, that our other departments have, is to make sure we are not just nipping away in ones and twos at that level of overdose death, but that we are fundamentally changing and tackling this epidemic like the public health crisis it is. And so to that end, I want to describe some of the things that we continue to do. As I've noted, as part of the Mayor's Breaking the Cycle initiative, we here at the Department of Public Health have a roadmap to tackling the crisis of behavioral health and homelessness here in the city. And that involves a much more proactive approach to try to help folks on the street with untreated or undertreated mental illness, addiction, and homelessness be able to get into effective treatment and sustained recovery. And a really important part of that is adding more treatment beds and treatment capacity at the right levels of clinical intensity. And at the right levels of clinical intensity is a really, really important piece. We have today what I would call a patchwork of different levels of care that if you talk to anybody on the streets or a nonprofit provider or a clinician, they will tell you it's incredibly difficult to navigate, to know what beds are available, and once you actually get into a treatment program, what is the next step, how long it takes you to get into that. If you talk to family members and other folks that are trying to help loved ones navigate this, it's incredibly confusing at times. It's difficult to navigate. Part of what we are building towards instead is a much more sensible system that actually functions as a system and has what I would think of as a ladder of support. So you go from the street to some sort of immediate stabilization where you can get engaged in treatment, have immediate needs met, be connected to services, and from there, ideally be able to enter into a range of more intensive treatment programs, say a residential treatment program that could be, 3 to 6 months in nature. And once someone graduates from residential treatment, they need a place to go as well. It's not enough to just count how many people get into residential treatment, because even if you graduate from that, and if you're going back to the streets without appropriate housing and other supports, the data show it's very difficult for those folks to continue to be successful in their journey on treatment and recovery. And so when folks leave residential treatment, we need to make sure there are more places for them to step down into where they can have housing. It's in a safe and supportive environment. And from there, that there are then paths to housing and other supports. And so there are a few things I want to emphasize that we are in the midst of rolling out at the city and county here in San Francisco that are part of that. One piece is on the very beginning of that journey, of that ladder, is our ability to quickly help stabilize people coming off the street and to get them services and treatment. One example of that, which was part of the recent announcement from the mayor of 279 recovery-focused beds that we're opening this year, many with sober living environments. We're launching a program called at the Keene, not too far from here, which will be a 76-bed short-term health respite program operated by Westside Community Services. What the program is it's for people just off the streets, complex medical and behavioral health needs. They can enter the Keene as part of a community and very intentional program. They can stay for between 30 to 69 days. They're initiating treatment. They're engaged in community. They're getting stabilized and connected to services. And we hope from there they're able to actually be ready to enter a residential treatment program. That is a very exciting model that will be opening right here in Soma. I think I've also mentioned as part of that front-end stabilization set of services is 822 Geary, the crisis stabilization unit. We're now a few weeks in. We are seeing how important that model is. That site is seeing individuals who are very sick. They're coming in, significant psychiatric needs and conditions. It is so apparent why that level of care is needed. Without that sort of crisis stabilization, those individuals would be on the street still with psychiatric distress, a range of substance use disorders, and needing a significant support. And so that I'm very, very pleased that we now have that expanded level of care here in the city. And finally, as part of the whole notion of having a ladder and a system, a logical system of folks to step through, we have been focused on expanding what we call residential step-down units. In particular, this is for folks that graduate from a residential treatment program, say for their drug use. They've successfully completed, say, a 6-month drug treatment program. They are sober. They are unhoused. We need a place that they can step down into for 1 to 2 years. That is a sober living environment that supports them in getting back to work, that has other vocational and financial and other social skill trainings. And so pending community input and approval, we plan to open the Marina Inn in the Marina, which will be a 68-bed recovery housing site for people who have completed a drug treatment program. They've successfully completed that, they're no longer using. They've chosen sobriety and they want to be in a sober living facility. They want a stable, structured recovery environment. The Salvation Army will be our partner in operating that site. Residents will be required to work. They will receive financial coaching. It will be a preparation for independent living. And it is really, really important as part of, I mean, literally the words, breaking the cycle and helping people build on the gains that they made in successfully completing and graduating from a drug treatment program and being able to be on their road to their path to recovery and independence. So with that, let me pause there and see what questions folks have.
Yeah, this new Marina Inn site, the work requirement, can you give a little more information about what that actually entails?
So the program with the Salvation Army is a multifaceted program. It's, as I noted, for folks that are graduating, have completed drug treatment, and it has multifaceted set of supports associated with that. Obviously, one is stable, safe housing, where someone might be there for 1 to 2 years. It also would involve a range of other skills development, vocational training. The expectation is folks are working. This is all part of being able to transition folks to being able to live independently in the community. There's also coaching for financial management and other life skills that really help them be ready to be successful independently in the community.
Do you have any concrete ideas about what has contributed to the decline in overdose deaths this month?
So, as I say each time, there are a whole range of factors in what drives the overdose death numbers. What's clear is that the entire system of care needs to really come together to make sure that everybody in need on the street we're able to support, we're able to get off the street into range of treatment and recovery options, and that is what we continue to be focused on. So those numbers I will continue to move up and down each month, I'm sure, and we won't be satisfied until those numbers look drastically different, and we have a very different public health situation here with respect to the opioid crisis and drug use.
How is the department's COVID-19 vaccine rollout going to be affected by the FDA's new guidelines that were published today?
I think I need to take a look at them. We'll get back to you. Thank you.
And then one more.
Okay. Supervisor Matt Dorsey just sent a letter today suggesting to transform the Embarcadero Navigation Center into a recovery-based treatment center like store. Do you have a response to that? Would you be open to doing that? Or
I look forward to discussing that with the supervisor. I haven't seen the letter yet, but thank you for noting that.
All right. Great. Thank you all.
Thank you all. Take care.